My name is Kathy Christensen. I'm the Chief Operating Officer for the American Med Spa Association. We are super excited to be here on site for Operation Mend to talk a little bit more about what Operation Mend does. And so we have Troy Simon here. He's the Executive Director of Operation Mend, and he's going to tell us a little bit more about what Operation Mend does and how it helps returning soldiers kind of acclimate both physically and mentally as they come back.
Operation Mend is a program that began back in 2007, and it treats veterans of post 9/11 Iraq and Afghanistan campaigns who have severe physical injuries, PTSD, and traumatic brain injuries. Our program started primarily as servicing all of the physical injuries, but then we've seen a huge prevalence of PTSD and traumatic brain injury, and so our program has evolved into treating that. And oftentimes, the physical and the psychological piece go hand in hand. Many of those veterans who have 20 and 30 surgeries and procedures to reconstruct their severe physical injuries. And as you can imagine, somebody that's gone through that physical trauma also has the psychological health trauma related to PTSD and traumatic brain injuries. So our veterans go through this program, no cost to them. We fly them out, we take them to all of their appointments, put them up in a hotel here at UCLA Health to make sure they get to all their appointments and they can go through their entire program.
And one of the interesting aspects of the program is it's not just appointments, it's a longer term program. Can you tell us a little bit about that?
Yeah, so on the physical injury side, our veterans come back many, many times for all types of different services. On the psychological health side, we have an intensive treatment program that condenses, over a year-long traditional treatment, weekly appointments into 3 weeks where we do over 100 sessions of treatment. It is very intense, but that program has created significant improvements in their PTSD symptoms, their depression, that we track very diligently to make sure that the program is effective. And we can show data that shows that we are making a change and an improvement in these veterans' lives and their family. We're also very unique in our psychological health program that we're one of the only programs, actually the only program that we know of in the country that actually treats the caregiver with the veteran in our program, because we understand the effect that this program has on that primary caregiver who's giving up nearly everything in their own lives to try to help this veteran. Every dollar that your organization does to support us allows us to bring more veterans to our program, because our program is not limited by demand. There's a huge demand for our services amongst these veterans. Your dollars directly contribute to improving the lives of veterans, and we're very appreciative of that.
We look forward to continuing to contribute and grow our relationship with Operation Mend. So thank you very much, Troy. We appreciate it.
Thank you.